Now, let's go over the meat and potatoes of hypertension that we need to know for the NCLEX in order to pass our NCLEX. And that would be pharmacology drugs used to treat hypertension. Now, let's first go over the first group of drugs, which are the diuretics, right? Now, basically, diuretics helps get rid of the sodium and fluid within the body, and it does this by interfering with the sodium absorption within the kidneys, right? And as a result of this, it increases the urine output in the body and it decreases the preload and the afterload. Now, as a side effect or opposite reaction from these effects from the diuretic, our patient would be at risk for having hyponatremia, right? And with hyponatremia, it's basically an electrolyte imbalance in which the sodium ion concentration within the plasma is lower than normal, right? And hyponatremia is generally defined as when the serum level of sodium is less than 135 milliequivalents per liter, right? And it can be considered very severe if the serum level is below 125 milliequivalents per liter, okay? Now, another side effect is orthostatic hypotension and dehydration, okay? Now, now let's go over the different types of diuretics that you will most likely encounter in the NCLEX exam, and that would include potassium-sparing diuretics, and one of the most common types is spironolactone, which is aldactone, right? Another group of diuretic is loop diuretics, such as furosemide, which is Lasix, right? Another group are the osmotic diuretics, and the most common drug of osmotic diuretic is mannitol. Okay, and lastly, we have the thiazide diuretics, such as hydrochlorothiazide or hydrodiuryl. Okay, now when we give patient thiazide diuretics, we need to make sure that we need to inform our patient that thiazides can cause the depletion, obviously, of sodium and water, but at the same time, it can also induce hyperglycemia in the patient. Okay, now let's go to another group of medications used to treat hypertension, which are beta adrenergic blockers or beta blockers. Now, as you have learned in nursing school, beta blockers or beta adrenergic blockers are drugs that help lower blood pressure. It also lowers the pulse rate and the cardiac output. Now, keep in mind that sometimes there can also be other uses of beta blockers, such as treating migraine headaches, treating glaucoma, and beta blockers can also be used to treat MI or myocardial infarctions, right? So, since beta blockers are an essential part of the NCLEX, we really need to understand, how this medication functions. Well, beta blockers simply act by blocking the what we call the sympathetic vasomotor response, right, within the body, and eventually this causes the decrease in the blood pressure. Now, for the NCLEX, try to remember that most of the beta blocker medications usually end with a syllable OLOL, right, or OL.
Big MAC, which basically goes over the three biggest main cardiac diseases that you will most likely encounter in the NCLEX. And that would include the myocardial infarction for M, angina for A, and congestive heart failure for C. Now, I'll also go over a few other diseases that um, you can encounter in the NCLEX, and that would include topics related to hypertension, pericarditis, and cardiomyopathy. Okay, now let's have a quick overview of the heart. Let's look at the quick anatomy of the heart as we learned from nursing school, right? The cardiac muscle is begins with the myocardium, the endocardium, and the pericardium. So let's first look at the myocardial infarction. And the important thing that we need to know to prepare for the NCLEX is that we all know that myocardial infarction is indeed death, right, of the myocardial muscle cells, and this is due to the lack of oxygen from inadequate perfusion within the body. Now, major assessment that we need to know for the NCLEX in relation to myocardial infarction or MI is that MI usually lasts longer than 30 minutes and it is unrelieved by rest or nitroglycerin, right? Therefore, that's how we can differentiate angina from MI through the use of nitroglycerin. Now, let's look at the diagnostic test results for MI, which is essential to know for the NCLEX exam. The EKG would show, the EKG in a patient with an MI would show an enlarged Q wave. So there would be an enlarged Q wave, and there would be either an elevated or a depressed ST segment, and then the T wave would be inverted, which is what we call a T wave inversion. Okay, so it would be again an enlarged Q wave, an elevated or a depressed ST segment, and a T wave inversion. And you really have to know that, okay? Now, in regard to drug therapy for patients with myocardial infarction, it's usually quite very similar to the drugs used for treating hypertension, which means medication can include your ACE inhibitors, such as catepin and enalapril, which is Vasitec. We also have our beta blockers and our calcium channel blockers. Now, as we all know, with ACE inhibitors, and you really have to know this and understand this, that the ACE inhibitors basically it blocks the conversion of angiotensin 1 to angiotensin 2, right? And it basically alters the blood pressure mechanism through what we call the renin-angiotensin system. Okay, now medications usually have would end in pril, right? Catepril and enalapril, ramipril, and the side effects for ACE inhibitors can include coughing, right, tachycardia, and nausea and vomiting. Now, what we need to make sure is that we tell the patient that we give this on an empty stomach or 2 or 3 hours after a meal, right, for this medication to be really effective. Now, let's look at the next set of medication, which is the beta blockers, which basically just reduces the cardiac output and decreases the what we call sympathetic nervous system response, right? So basically, it blocks the beta receptor, causing the decrease in blood pressure. And the medications in this category usually ends in olols, right? Metoprolol, your propranolol, acebutolol, your nadolol, right? Now let's look at the adverse reaction that we can see in our patients. The patients can have side effects of bradycardia and hypotension, right? And we also need to watch out for this adverse reaction of hypoglycemia. We need to really be aware of that, since beta blockers actually disrupt the liver's ability to convert glycogen to glucose. Therefore, we need to be mindful of that. Now, lastly, let's look at calcium channel blockers, which basically prevents the movement mechanism of the calcium within the cardiac system. And what it basically does is it basically decreases the cardiac workload and the cardiac muscle contractility. Okay, now the medications would usually end in dipine, right? Such as amlopidine, which is Norvasac, and ifidipine. Now let's go ahead and continue and look at A in our Big Mac of essential cardiac diseases that we need to know for the NCLEX. Now A stands for angina pectoris. Now it's basically pain caused by inadequate blood flow to the blood vessels of the heart, and basically our poor patient would usually describe the pain as a squeezing, heavy discomfort, pressure, right? So again, pain is the number one symptom for a patient with angina pectoris, and it's basically a substernal pain that can radiate to the neck, the jaw, and the back. Now, compared to MI or myocardial infarction, the pain from angina may be relieved by rest, okay, compared to our patient with a myocardial infarction. Now, risk factors or causes for angina usually is due to the fact of the patient has previous atherosclerosis, the patient can have hypertension, or diabetes mellitus. Now, there are different types of angina, but we really don't have to know the specifics for each one. It's just important that we understand each type. Now, there is the stable angina. There's also the variant, or what we call the Prince metal angina, and lastly is the silent angina. Now, the stable angina, it basically it occurs with exertion, and it's relieved by rest, and it doesn't increase in frequency or severity. On the other hand, variant or Prince metal angina usually increases in severity, especially with exertion. Now, the third one, the silent angina, is usually asymptomatic, which means that we don't really see much symptoms. Now, the EKG in our patient will show an ST segment depression, and the T wave would be inverted, which is called a T wave inversion, usually during the anginal pain when the patient is having the pain. So again, the EKG will show an ST segment depression and a T wave inversion.
So the main medication for a patient with angina is usually nitroglycerin, in which the patient can take up to 3 tablets 5 minutes apart. And if still no relief happens, then we tell the patient to go to the hospital, right? And we need to make sure, we need to be mindful that we hold any nitrates if the blood pressure is less than 90 milligrams of mercury. Okay. Now, what we tell our patient is that we tell our patient to place the nitroglycerin tablet under the tongue and we let it kind of melt, right? And we don't give the patient any fluid while taking the tablet, right? So no fluid with the tablet, and we make sure that we store the tablets in a dark bottle because light lessens its efficiency. Thank you so much for listening, and